So upon entering the facility, I have already started my objective examination for the patient for the overall impression. So the patient is mesomorphic. She wears eyeglasses and wears an hearing aid. So the patient doesn't have unusual body odor, no breath smell, and there are no alcohol odors noted. So as you can see, the patient is alert and oriented 3 times. So as to person, place, and time. The patient is conscious, coherent, and coordinated.
Sa mata ka ng pakalitan, tuyok lagi ginagtibok kalibutan lagi. Okay, so, Ma'am PV. Sige. Ma'am PV,
So even if she waits for a few seconds before answering the question, her communication skills are good. She can express herself fluently and spontaneously. As to concentration, well, it's good also. She's not distracted, and for the attention, she is able to focus and sustain the task.
Ang akong kuan gud kanang unsam day magbuhat ako kay katong pag-batch for do big badminton ng bana karon kuan man pagsaon ako sa tulkak.
So, while she's talking, I have noted that her behavioral status are she presents with a clean appearance wearing a off-white cashmere shirt tucked on a pair of teal trousers with a pair of white sneakers. She wears light makeup on her face. She wears a mid-cut hair in a loose bun at the nape of her neck, vigilant upon entering the clinic with a bit of fear showing on her face while trying to hold on something for support. She looks at me, the therapist, in the eye all throughout the interview. Maintains her head midline and stiffly along with her body was sitting on a plastic monoblock chair all throughout the interview like this, to avoid head movement as much as possible. So her memory is unimpaired because she was able to recall what happened to her during the March 4 in the last weeks. Perceptual assessment, she was able to grasp my hand during shake-hands.
Ikaw manggod ako siya gitanaw ba? Oo, tanaw na ko siya. Minar ako gamay sa mga instruction nga na. Katong kana sigurong mga usang pagsakong tira iya gurong
So she is a visual learner. She only needs verbal and tactile cues to support her visual learning. She keeps her hands clasped on her crossed legs and only unclasps them when she repositions her eyeglass or covers her mouth upon yawning.
Gabi ng eyeglass pa ta. Drink it pa ta. Ha? Samot na ning eyeglass. Buwan ako ang eyeglass. Yung kita ni mo.
Oh, that's her learning barrier. She needs to wear her eyeglasses or else she can't read. She has a difficulty reading without them.
Sa pag-video vital signs o sa imong skin assessment. So, ang mato na tuon itong tapika sa mga gamit, wala man may manual na kuan, pang-BP na aparato, so kanala na digital o kaning digital thermometer. Ang tuyo sa pag-take sa vital signs, kay para mabuhat mong healthy ka sir, imong general health status. We will take your temperature, we'll take the blood pressure, heart rate, and even kanang sa how many times you breathe in a minute. So, una anak ako ning kuan sa ang thermometer. Ang sige gusto niyo sir na ikaw ang pumunta sa mga
Ako lang.
sige sir, dali lang sa pikas na side, makita sa side, mag-take ta sa blood pressure. Ako sa next to ang table sir ha. So sir, pila ang baseline sir? Baseline blood pressure usually?
Katunas na ako, 100 man po niya, 64.
Okay sir. Okay. Dito sir, sa pagkuhan. Mutingo kayo na siyang thermometer sir kung mananagid siya. Ang kaning kuhan, kanang minuto na trip ang pag-take sa BP, katong siya manual, yung kanina to ang sounds sa iyong mga kuhan. Gusto mo ka sir, kalma lang sa to, makatanag-dandagan anywhere before next week. Relax naman ka, no? Sige sir. Nako din sir, mag-take ko sa imong pulse sir ha. Ganun po sa imong BP. 1, 2, 3, go. Okay, so repeat na po siya sir. So ang imong heart temperature is 36.1. Yung akong pag-count sa imong kuan, how many times you breathe in a minute is 17 cycles per minute. Ang imong pulse rate is 80 beats per minute. Then ang imong blood pressure is 130/110. Okay sir, so normal naman na sila, wala kay problema sa imong heart, sa imong kuan, way of breathe. Okay? So dili na to sunod sa imong nalipong kay part sa mo proceed sir sa atong chest expansion sir. So naglingkod naman kita, mayo gid ng time ni siya na ma-assess ko sa imong skin. Ang tuyo ani sir, may baan ako if napabakay lain sa mad, nabakay mga burot-burot. Pwede na to siya ma-adjust here, dili physical therapy. Okay sir? Sige, so akong gunita ng imong mga 1, legs, arms, o imuhang neck. Okay ra ba, sir? Dili ka alain, sir? Okay, okay ra ka na katumata sa imo, sir? Sige, sir. So, muna ko sa imuhang neck, sir. So, kabaw ko, sir, nagdili problem sa imuhang neck. Kapit, dili na ko sa braso, sir, ha? Okay. Ako sa imuhang siya, sir. Wala mong patay sakit ang ikuan, sir?
No.
Wala?
No.
Nahingan ko sa ikuan niya siya kanang, muna bag naman po na kuan kanang, kapit sa mga skin check, wala mo sa'yo. Move na, umong kamot, okay naman po. Umong ko sa tikas mo, sir. So, dili na ko sa expansion na measurement. Ang ana dito yung ana, to know if imuhang lungs can function properly and if naapektuhan ba siya kung kasi or posture. Okay, sir, so kung saan akong gamit na to, we're going to use a tape measure. So, patihog na ko barong lang, sir. Okay, sir, so I would be here. So, okay, sir, na bunitan kita, sir, kaya modoy ko mo. Sige, sir, so I will be measuring 3 levels. Kani, so ubos yung ilok, sa imong nipples, ubos yung nipples, okay? So, bulusot, ako na ilusot, sir. Thank you kayo sa pag-experience yung arms. Sa diri, ubos yung nipples, ubos yung arm, chest. So, 1, so we've got 35, 1, 2, 3, go. Okay, we've got 38. Got 38. So, 58 cm. So, 3 cm expansion yapon. So, okay lang yapon, sir. Kanang, wala problema ang imuhang lungs when it comes to breathing, and wala pa nakita sa imong core posture. So, cardiovascular and pulmonary assessment and skin assessment. Thank you so much, sir, and have a good day.
So next is the sensory assessment. So good afternoon, Miss. My name is Delcia Casanova, and I will be doing a sensory assessment. So this is for me to determine whether or not there are any areas with abnormal sensations. So will that be okay, ma'am? Yes. I'll be introducing you two different sensations, okay? First, this is the sharp. This is the dull. Okay, Miss? Okay, so you feel that? This is the sharp, and this is the dull. Okay, I want you to close your eyes and tell me whether it's sharp or dull you're feeling, okay? Sharp. Sharp. Are two test tubes, so this is the hot and this is the cold, okay? This is the hot and this is the cold. Feel that? Okay, what I want you to do is to close your eyes again and tell me whether it's hot or cold. Okay, 1, 2, 3, go. Cold. 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 The use of this cotton ball, I will be touching it on different parts of your body, and this is what light touch feels like. Do you feel that? Yes. Okay, so I want you to close your eyes and say yes whether you feel the light touch or not, okay? Yes. Yes. The use of this pen here, right here, the dull area, I will be touching you again in different parts of your body, and this is what pressure feels like. Do you feel that? Okay, so again, I want you to close your eyes and say yes if you can feel the pressure, okay? Yes. 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 Okay, next are the deep sensations. So first is the proprioception. So, Miss, right now, as I move your arm in different positions, what I want you to do is just copy or duplicate the position on your other arm. Okay, Miss? So let's try it first while your eyes are open. Okay. Okay, now I want you to close your eyes and just do the same thing, okay? Just duplicate that position. 1, 2, 3, go. Again, Miss, I will be moving your arm, this time, kay directions, okay? So I'll be moving your arm in different directions. So this is up, this is down, this is out, and this is in. Okay, so I want you to close your eyes. And as I move your arm, I want you to tell me which direction it's going, okay? Okay, 1, 2, 3, go. Out. Down. It's done. Or is assessed with the use of a tuning fork. So the handle of the tuning fork is held between my thumb and my index finger without touching the tines, and then the tines are hit against my palm in the opposite hand to initiate the vibration, and the base of the tuning fork is placed over the bony prominences of the patient and ask the patient whether she can feel any vibration or not. I will be touching you with the use of these clips on different areas of your extremities, and I want you to say yes if you can feel it, and tell me 1 if you can only feel 1, and 2 if you can feel 2 sensations, okay? Let's start. Yes, 2. Yes, 2. Right now, I'll be introducing you 4 different objects. Okay, so I want you to feel it, huh? So first, that is the marker. That is the pen. This is the highlighter. Okay, and lastly, this is the pencil. Okay, Gmail. Okay, so I want you to close your eyes, and I'll be giving you 1 object, and I want you to tell me which object it is, okay? Okay. First object. Highlighter. The use of these 2 paper clips, Kai, I want you to tell me 1 or 2, depending on how many sensations you feel, okay? So wait, testing first, miss. Do you feel that?
Yes.
I want you to close your eyes and say 1 or 2. 1, 2, 3, go.
2.
Okay, I'll be drawing different shapes on your palm, okay? So this is my starting point and also the end point, okay? So first, this is circle. This is triangle. This is square. And this is star. Okay, so right now I want you to close your eyes and guess the shape na aking draw, okay? 1, 2, 3, go. Circle. So after testing all the sensations, the patient showed normal sensation as to superficial, deep, and combined cortical sensations. However, during the pain sensation, okay, the patient felt dizzy when she suddenly rotated her head towards the testing area.
So the next assessment would be your deep tendon reflex assessment. So this is important to test the integrity of the nerves throughout your body, whether they are functioning or not. Okay, so I'll be using this reflex hammer to test all the reflexes. So we'll be checking 1, 2, 3, 4, 5. 5 reflexes in both sides, left and right. Okay, so let's start with your right side first. Okay, again, clench your fist and then bring it upward with force. Okay, so enough na sir? Yes. Enough. I want you to look away. Okay. So again, one more time. Okay. Look away, please. Your radialis, your reflex. Okay, so fist, make a fist, and then again bring it this way. Okay, go. Okay, so look away, please. Biceps. So this position of the sir, and I'll be supporting you here. So to feel the tendon here, I want you to extend or straighten your elbow, please. One more time. Okay, here. Ano matalikod, sir? Okay na ka na position. Sige, relax lang, relax. Let it go. Okay. Look away, please. I will be assessing the reflexes on your legs. So let's start with your right leg first. So right leg over your left leg. Okay, so stay in that position, sir. Okay, again, I'll be checking ha. Straighten lang ako siya. Okay, so look away, sir. Look away. Your leg. One is your Achilles, so I want you to stand up here. And then, i-rest lang na to ang atong knee here. Yung left knee, kayo patok dali. Okay, right knee, I mean. Okay, pwede na sa both. So, okay, sana lang sir. Comfortable na ka, hold lang din na pwede kayo matabak. Sige. So, sa imong right gihapan ang Achilles lang doon. Then, relax lang na to. Okay? Okay, sige. Start ako. So the last neurological assessment that we'll be doing is your cranial nerve assessment. So this is to check the integrity of the cranial nerves in your body, whether there are any impairments in any of your cranial nerves 1 to 12. Okay? So are you ready, sir? So follow each second with your eyes without moving your head. Okay? So can I remove your glasses? Okay. Hold lang. Pwede rin naman hold, sir. Thank you. Okay, so I will start na ha. I want you to follow this. So, do you see double vision or no? So, do you see a pen? One nandiyon. Okay, so very good. So, next, flashing light, same eyes. Okay, just a quick flash lang ha, to check. Alright, look. No. Okay, so, very good. So, pwede na mo yung balik sir. This is your cranial nerve 8, so vestibular nerve. So, this will involve your hearing sense, okay? Your sense of hearing. This is a tuning fork, and in this test, you will hear a buzzing noise. So just tell me where you hear the buzzing loudest. So start, position A, or position B. Asa sir? A. Okay, so other side is again, you will hear the buzzing again, and tell me if asan yung nag-hear loudest, and either your left side or your right side. Okay? Okay, so sir. Left or right? Left. Okay, so that's it. So that's the end of our cranial nerve assessment. Thank you so much. That's it.
Hi ma'am, ako si I am JR Pon, and I will be your PT for today, mama. So for now ma'am, what we will do is I am going to assess your musculoskeletal system. So basically your muscles and your joints. So ako nang i-assess. Then I will be explaining to you later as to unsa ko mga assessment, mama. So first, okay lang, pwede na tayo mag-start ma'am. So I'm gonna review your chart, ma'am, ha? So your height is 171 centimeters, correct, ma'am? Okay. Your weight is 57 kilograms. Okay. So your BMI is normal. So ako siyang i-check yung gross body symmetry. So kan sit well lang, ma'am. Sit up, ako lang i-check. Okay. So upon assessment, the gross body symmetry is normal. Your gross ROM, try to move your head down, ma'am. Try to move your head a little bit. Ano sa'yo mo ma-feel, ma'am?
Medyo labad sa'yo kung ganyan.
Maglabad mo. So dili kay kaka-move mo, no? Gamay, no? Sige. So impaired ang cervical nga ROM, then impaired po si cervical nga muscle strength. Okay, so we're now assessing your range of motion. So this is what you call a goniometer. So this is used to assess the range of motion sa imuhang joints. Okay? So dili ma-check kung unsa kadako or how little is the movement of the specific joint sa imuhang body. Okay, ma'am? So ang atong i-assess, ma'am, is imong cervical sa imuhang head and neck. Okay, so atong first motion, ma'am, is called a cervical flexion. What you will do is, so sit up straight, ani, ma'am. Okay? So what you will do is, ang imuhang head, you mulingi ka downwards using your head, ma'am. Sige, practice na already. 1, 2, 3, go. Okay, sige. Ana, ma'am, no? Sige, ma'am. So mag-start na ta, ma'am, ha? Start ito ang assessment, ha? Okay, so ito nga, align sa akong goniometer 2, 0. Sige, ma'am, when I say go, move ta head downwards, ma'am, ready? 1, 2, 3, go. Sige, down yung head. Sige.
Medyo labad sa'yo.
Dili na ako top. Sige, thank you, ma'am. Sige, okay na, balik na yung head sa normal position. Okay, so ang value sa imuhang kuan is 0 to 23 imuhang flexion. Karon na sad, so ang atong movement, di ba, ganiha was called flexion. So gi-bend nimo karon, raise your head na sad, face the ceiling. So same ra gyapon ta, ha? Katong gyapon practice daw ta. Sige, okay, ready? 1, 2, 3, go. Sige na. Okay, sige, ma'am. Sige, so ako na i-assess, ma'am, ha? Sige, ready? So when I say go, raise your head, ma'am, ready? 1, 2, 3, go. Sige, raise your head. Sige, na kayo, ha?
Okay.
Kaya maglabad mo, ma'am?
Oo.
Sige, balik mo yung head sa normal position. Okay? So for your extension is 0 to 23 degrees. Assessing your lateral nga flexion. So imong buhaton is from your head from the midline. So move, imong i-bend imong head to the side, ma'am, ha? Okay? Ako dito face dito, imong natin chair face na dito. Ayan, ha? Okay? Sige, ma'am. So, palapit kami ngayon, ha? Okay, so stabilize lang siya, ha? Sige, okay. So when I say move, ma'am, i-move imong head sa right, ma'am. So practice na again. Ready? 1, 2, 3, go. Sige, right?
Okay.
Okay, malipong ka, ma'am?
Oh.
Sige, ha? Sige, ready? When I say move, move down, ha? Sige, ready? 1, 2, 3, sige, move. Okay.
Lipong na.
Okay, malipong na ka. Sige, balik na, ma'am. Okay, thank you very much. So for your lateral flexion is 0 to 22 degrees. Okay. For ROM, kay cervical rotation ta. Okay. So imong motion is your head, diha na midline. So imong head, i-move na mo, rotate, ha? So imong i-turn imong head to the right. Sige, practice na, ha? Sige, ready? 1, 2, 3, go. Sige, turn. Ano? Okay, sige, balik na, ha? So muna itong buhatan, ma'am, ha? Sige, let's start. So align sa ako ang goniometer, ma'am. Okay, straight lang back para stabilize. Sige, ma'am, when I say move, okay, move yung mga head, ma'am, ha? Sige, ready? 1, 2, 3, go. Sige, turn yung mga head.
Labad na.
Laban na. Sige, okay naman, balik na. Okay, thank you very much, ma'am. So for your rotation is 0 to 30 degrees. It's called MMT. So manual muscle testing. So this is for me to know if pila or unsa kakusgan ang imong muscles sa imong body, ma'am, ha? Especially sa imong cervical area, so sa imong head and neck, ma'am. Sige. So para at ease ka, ma'am, mo-start lang sa katong test nga naglingkod ka para para diretso na lang ato ang position nga nag-lie down. So ganing ang lateral flexion. So it's when your head is in the midline, then imong i-bend pa side. So ang difference now is I will not use anymore the goniometer. So I will be resisting the motion. So I will ask you to perform again while I put resistance, ma'am, ha? So practice na sa motion again, ma'am, just for kuan lang your compliance, no? Na makabaw ka. Sige, ready? 1, 2, 3, go. Okay. Ana, ma'am, ha? Sige, so karon, ma'am, I will be putting any resistance. Then tell me if na any problems, ma'am, ha? Or katuon sa akin di pa mati during the assessment, okay? Sige, so resist ko. Sige, when I tell you to do the motion, do it, ma'am. Ready? 1, 2, 3, go. Sige, kunta akong resistance, ma'am. Okay, just tell me na problema na, ha? Labad na. Sige, balik na, ma'am. Okay. Thank you very much. So after the sitting position, alin na ta sa manual muscle testing sa supine position or well gihigda ka, ma'am. Sige, ma'am, higda ta dili sa ato ang bed. So one more. Okay. So I want you to lift your head to the ceiling kanang without kanang moving your chin, ma'am, ha. Na kanang sumura gyud nimo i-push imo ang head pababaw. Sige, ma'am, practice daw ta. Sige, ready? 1, 2, 3, go. Okay, very good, ma'am. So kato with just the same with katong lateral flexion nato nga MMT, I will be putting resistance on your forehead, ma'am, ha. So I want you to counter my resistance. Then tell me, ma'am, if there is anything wrong, no, or nakagi pa mati, okay? Sige, ma'am. I will start, ma'am, ha. Sige, ready? Ready, ma'am. 1, 2, kung resistance ko, ma'am, ha. You ready? 1, 2, 3, sige, go. Okay. Oh, labad na. Sige, sige. Okay, ma'am. Down na. Typical nga, rotation. So, for this, I want you to turn your head to one side. So, ano lang. So, ang imong buhaton is to turn your head from this side to the other side, ma'am, ha? So, from your left, move ka, padung sa right. Then, I will be putting resistance sa imong movement. Then, I want you to counter my resistance. Sige, ma'am. So, practice na to, ma'am. Try to move your head. Sige, ready? 1, 2, 3, go. Sige, try to move your head. Okay, sige, balik, ma'am. Okay, put ang resistance, ma'am, ha? Okay, ready? So, 1, 2, 3, go. Sige, ma'am. Try to do the motion.
Ay, laban na.
Oh, laban na. Sige, balik, ma'am. Okay, sige, head dun sa, butang sa head sa tunga, ma'am. Itong normal position na, ma'am. Okay, the last motion that we will do is called the cervical extensor. So, lie on your back daw, ma'am. Lie on your belly. Then, ihang mo imong head. Dili, ma'am, ha? So, sige, ma'am, before na to ihang imong head, so listen to my instructions lang. So, ang imong buhaton is, di ba, maghang man na imong head sa floor. So, don't worry, I will be supporting your chin. And I want you to do the opposite thing we did ganiha, katong from lift your head to the ceiling. So, karon lift the back of your head sa ceiling, ma'am, ha? So, same sa opposite sa kato ang gibuhat ganiha. But don't worry, ma'am, di na ko i-drop ang imong head. I will be stabilizing and supporting you through the course sa kaniya treatment. Okay, ma'am? Sige, ma'am, ihang na mo imong head, ma'am. Okay, don't worry, mag-support ako. Okay, stabilize lang ta. Sige, ma'am, when I say go, do the motion, ma'am, ha? Okay, ready? 1, 2, 3, sige, go. Before, ma'am. Okay?
Ay,
Oh, labad na. Sige, balik mo, ma'am. Start na ta position. Okay? So, thank you very much, ma'am, for this musculoskeletal assessment. Yan, mag-proceed na ta sa next test mo, ha? So, thank you very much, ma'am.
For coordination assessment, for the non-equilibrium test, it's finger to therapist finger. So this is the therapist finger and this is the patient's finger. The patient is instructed to connect his finger with the therapist. And the therapist will then change the position of his finger. So the patient is instructed to follow. This is the therapist finger. Patient's finger. Next is the finger to nose. So the therapist instructs the patient to touch his nose, the patient's nose, with his finger. So here, this is finger to nose non-equilibrium assessment. Eyes open. Toe to therapist finger. The patient is instructed to point his toe, connect his toe towards the therapist's finger. So this is the therapist's finger. So toe is to connect here. There. Tapping of the upper extremity. The patient is instructed to just tap his or her upper extremities with eyes open and then eyes closed. Tapping of the lower extremities is the same but with the legs. So tap here, one hand, eyes open, eyes closed, and then the other, and then bilaterally. So eyes open, eyes closed. For heel to shin, the therapist instructs the patient to trace his shin with his opposite heel. First done with eyes open and then done with eyes closed. For equilibrium assessment under coordination
Assessment, it's one is sitting in a comfortable position with no backrest. And then the patient is instructed first with eyes open and then eyes closed to just sit there. If the patient is shifting or shows signs of falling, that is recorded as moderate to severe inability to complete the task for coordination. The next
is sitting with weight shifting in all directions. So sitting and then shifting the weight to directions. First with eyes open and then with eyes closed. The next is sitting with a multi-directional reach. So we ask the patient to sit and then reach multi-directionally. So reach here and there. Reach forward, reach to the side, and to the other side, and to the back. With eyes open first and then eyes closed. Next is standing in a normal, comfortable position. The therapist instructs the patient to just stand. And next is standing in weight, shifting in all directions. The therapist instructs the patient to distribute his weight all over multiple directions. Romberg test is with the patient in a standing position with feet together. So, the significance of this is patient has unimpaired balance and postural control if he presents with no swaying while standing with feet together, with both eyes open and eyes closed. The next is Romberg exam is done with the patient's foot in front of the other. So this is the tandem stance. Looks like this. And then if the patient has no swaying while in a tandem stance with both eyes open and eyes closed, he has no unimpaired postural control. For
clinical test of sensory interaction in balance. So there are 4 conditions. The first is with eyes open and on a firm surface. So the patient stands with eyes open on a firm surface, time for 30 seconds. And then if the patient does not open his or her eyes, during the closed eye condition or raises his arms from side to side or loses balance and requires manual assistance, then it is graded as normal. The condition 2 next is eyes closed and the feet are still on a firm surface. The next condition 3
is eyes open and then feet are on a foamed surface. The next is eyes closed. Condition 4 is eyes closed and feet are on a foamed surface.
So, nagkaroon naman dito, ma'am. So, assess na lang po natin itong posture. So, okay, malipong man ka, kung magtuyo ka, mag-change your position. So, pinag-draw na lang is mag-barok na lang ka. Steady lang ka, na ako na lang ang mo. Ako na lang ang mo tuyo. Okay? Kuhaan ka lang. Normal, comfortable position lang ikaw sa pag-barok. Okay? Sige, ako na lang. Ma'am, na humalit nag-assess. Ang ako ang kitaan, ma'am, kay kuan ka, mama. Dili man gid kayo, kuan, ma'am, tsaka poor yung posture. More of, dili lang gid mo gusto liho ko ng imong neck when kuan, para dili ka malipong. So, what you did is, iuna yung ulo. Yung tungkol yung una mang ulo, muna na pagbuko. Pero kana siya, makorek na siya nato with kuan, kanang postural training. So, mga midline naman tanan, mga symmetrical naman mostly ang imong mga kuan, kanang landmarks. And ano dito, bako lang ka din, forward headed ka. Okay, ma'am, thank you, ma'am, for this postural assessment. So, dili na po sa gait assessment, okay? Okay, ma'am, so dili na to sa gait assessment. Gait assessment or walking assessment. Ang tuyo or gait ani, ma'am, is using this form, the RLA form, ang tawag na mo ani, is to specifically identify asa ang naay mga problems or what are the problems that you encounter when walking. So, kung sa itong buhaton, ma'am, para in order to save time o para dili maglaban na imong ulo, basigi og lakaw-lakaw, we're going to use a camera. Dato na ka ng thumb. We're going to use a camera na mo picture sa imo while maglakaw. Not picture, video ka while ka maglakaw. Then, imuhang body, videohan, ang imuhang lower leg, videohan. So, kausaragid ka maglakaw. Kami na bahala ang assess or mo check if asa ka ang naay problem. Okay, ma'am?
Ma'am, I would like to ask you if you have any problems regarding peeing or pooing. No, I don't have any problems in peeing or pooing.
So, ma'am, I'm gonna ask you a question. What is 5 plus 5?
Yes, it's 10.
Oh, so what did you have for breakfast today, ma'am?
Oh, I ate bacon and eggs for breakfast.
First things first, I assure you that anything that happens here stays here and information that will be exchanged between us stays here. And also for this test, this is called Tick's Hall Pipe test. So this is basically to confirm your current diagnosis, which is BPPV or benign paroxysmal positional vertigo. And this test, it entails me to touch some parts of your body, specifically your head and neck. Would that be okay? As this would entail me as physical therapist to do a manual contact. And also, this test will provoke your symptoms, vertigo and dizziness. But you don't have to worry about that because I'm just going to be here all throughout the procedure. So if you have any questions or if you have something to clarify, just ask me. And if you feel uncomfortable, since this would provoke your symptoms, it would cause your production of symptoms, so tell me immediately so that we can do something about it or stop about it if you feel like it. So let me start now. Okay. So I just want you to lie on your back, your head here. Okay. So I'll just strip your back. So again, if you feel uncomfortable, if you cannot tolerate the reproduction of symptoms, vertigo, dizziness, just tell me immediately so we can do something about it. We cannot stay long at it. Okay. Okay, so that would be it, ma'am. It's all like that. So the patient's eyes. So there was presence of nystagmus, vertical upward nystagmus, as the patient's head was rotated to the right, and the patient also complained about dizziness and vertigo. And the nystagmus only lasts about 15 seconds. This test will provoke your symptoms, the symptoms that you always complain about, secondary to your condition, which is BPPV or benign paroxysmal positional vertigo. So this can mean anything, just tell it to me immediately, and if you feel uncomfortable, just speak about it so that we can do something about it or even stop the procedure. So let me start now. Okay, I just want you to just look at my nose. So even after, look at my nose and make sure your eyes are open, even if you feel like falling down or if the symptoms would be reproduced, if you feel vertigo or dizziness, just try to look at my nose as much as possible and open your eyes, okay? Let me start now. Okay, just look at my nose. Okay. Okay, so that'll be all now. So the result of this test, so the patient's eyes, during the test, the patient's eyes deviated from my nose, which would indicate an impaired vestibulo-ocular reflex, which would further confirm the patient's nystagmus and the patient's condition, which is BPPV or benign paroxysmal vertigo. So that session, I am going to ask you some questions, so specifically 25 questions. Would that be okay? And I will give you a copy for you to be guided all throughout the interview. Okay, so would it be okay if we are going to start now?
Yes.
Okay, so first, does looking up increase your problem?
Sometimes.
And because of your problem, do you feel frustrated?
Sometimes.
Because of your problem, do you restrict your travel for business or pleasure?
Sometimes.
Does walking down the aisle of a supermarket increase your problem?
No.
Because of your problem, do you have difficulty getting in or out of bed?
Always.
Okay. Does your problem significantly restrict your participation in social activities such as going out to dinner, going to movies, dancing, or to parties?
Sometimes.
Okay. Because of your problem, do you have difficulty reading?
Sometimes.
Does performing more ambitious activities like sports, dancing, and household chores such as sweeping or putting dishes away increase your problem?
Always.
Okay. Because of your problem, are you afraid to leave your home without having someone accompany you?
Sometimes.
Because of your problem, have you been embarrassed in front of others?
No.
Okay. Do quick movements of your head increase your problem?
Always.
Okay. Because of your problem, do you avoid heights?
No.
Does turning over in bed increase your problem?
Always.
Okay. Because of your problem, is it difficult for you to do strenuous housework or yard work?
Sometimes.
Okay. Because of your problem, are you afraid people may think that you are intoxicated?
No.
Because of your problem, is it difficult for you to go for a walk by yourself?
Sometimes.
Does walking down a sidewalk increase your problem?
No.
Because of your problem, is it difficult for you to concentrate?
No.
Okay. Because of your problem, is it difficult for you to walk around your house in the dark?
Sometimes.
Okay. Because of your problem, are you afraid to stay home alone?
Sometimes.
Because of your problem, do you feel handicapped?
Sometimes.
Has your problem placed stress on your relationship with members of your family or friends?
No.
Because of your problem, are you depressed?
No.
Okay. because of your problem, or does your problem interfere with your job or household responsibilities?
Sometimes.
Okay. And lastly, does bending over increase your problem?
Always.
Okay. So that would be all for the questioning, and I assure you that anything that happens here, any information that would be exchanged between us, the information that we have just talked about would stay here. So can I have this one? Okay, so thank you for your participation and cooperation. And this interview today, these questions would really help me assess further your condition.